come to your light, and the kings to the brightness of your rising. The Gentiles shall come to your light, and the kings to the brightness of your rising. I see you, you are rising, rising. I see you, you are rising, I see you, you are rising. The Gentiles shall come to your light. I see you, you are rising, rise. I see you, you are rising, I see you, you are rising. The Gentiles shall come to your light. Arise and shine, your light is come. The glory of God is upon you. Arise and shine, your light is come. The Gentiles shall come to your light. Arise and shine, your light is come. The glory of God is upon you. Arise and shine, your light is come. The Gentiles shall come to your light. I see it, your light is shining. I see it, it is shining. I see it, the light is shining. The Gentiles shall come to your light. I see it, it is shining. I see it, it is shining. I see it, the light is shining. The Gentiles shall come to your light. Gentiles shall come to your light, and the kings to the brightness of your rising. The Gentiles shall come to your light, and the kings to the brightness of your rising. Lift up your eye, round about and see. They gather together to come to you. Your son shall come from afar and near, and your daughter shall be nursed at your side. Lift up your eyes, round about and see. They gather together to come to you. Your son shall come from afar and near, and your daughter shall be nursed at your side. I see you, you are right. I see you, you are rising. I see you, you are rising. I shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. The Gentiles shall come to your light, and the kings to the brightness of your rising. The Gentiles shall come to your light, and the kings to the brightness of your rising. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. But the Gentiles shall come to your light. I see them, they are coming. Your victory. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light. I see them, they are coming. I see them, they are coming. I see them, they are coming. The Gentiles shall come to your light.
Amazing evening. Okay. Amazing evening, everyone. Amazing and beautiful evening. Another time with Blessed Family Life You're welcome once again. It's good to see you tonight. Please share this link. It's going to be very impactful, educative, and enlightening. You're welcome. Please let us know where you are connecting us from. Sister Busayo, thank you for connecting us tonight from Ondo, Nigeria. Thank you so much. We will introduce our guest shortly. Amazing evening, everyone. Once again, you're all welcome. It's about Blessed Family Life. It's a monthly program. If you've been joining us, if not, please check our YouTube channel. You see previous messages there. What is the focus? What is the vision of Blessed Family Ministry? It's about Christ Center Home, Christ Center Family. And every month we have different guests on different topics that impact family lives. And tonight we have Dr. Sharon again. If you were with us the last time, Dr. Sharon was with us and we had a very wonderful session, a wonderful time. But I would like to apologize because for those who gave us feedback, it was like because of the audio problem, there were some interruptions and that affected some of the discussion. So that's why we are bringing Doctor back tonight. Dr. Sharon is here tonight. I will want you to welcome her and appreciate her, for honoring our invitation the second time again. And I promise you, tonight is another time that we are going to be enlightened, educated, and be impacted. And I know our expectations shall not be cut short in Jesus' name. Now, what is the topic tonight? Is God in Science, Part 2. We have done Part 1. That's why I said, please check our YouTube channel, subscribe, and check the previous message, the Part 1. So tonight is Part 2, and it's more about what we discussed last time, highlighting it the more. The doctor will talk more about that today because we had feedback that some of the discussions were interrupted. So we have doctor back tonight. We have Dr. Sharon Peters. She has done the introduction in the first part. Please check the first part and listen to the introduction there. She's been a fertility physician for several years. She works with FertilCity Clinic, Lekki, Nigeria, Lagos. This woman is an amazing and amiable doctor. And from my interaction with her, I will see this profession as a calling for her. It's from her clinic that I learned that a 53 years old had triplet. That really wowed me. And honestly, don't let me just jump. Tonight we are going to hear more from her, and I know our expectations shall not be cut short in Jesus' name. Fertility is no longer existing, so we need to learn more about it. Information is power. So tonight I will introduce our guest shortly. Please, I will want you to welcome Dr. Sharon Peters and appreciate her. Please appreciate her in the chat. Please, and let's know where you are connecting us from the chat. We have the first 20-25 minutes for her, and after that we'll have question and answer. Beloved, this is a free consultation. If you need to consult her, you have to pay for consultation. I believe this is an opportunity for you and I to consult, to ask questions. Any question on fertility or infertility, she's here for us to answer it. And we are blessed to have her tonight. So I will introduce my guest now. Wow, doctor, you are welcome once again.
Yes,
It's
ma'am.
beautiful to have you here with us tonight. Thank you for your time. We appreciate you so much.
Oh,
Thank you.
thank you, ma'am.
Thank you for your love for us. You're looking beautiful tonight.
Wow, thank you, ma'am.
And this place is so
Thank you,
bright
ma'am.
now tonight. Thank God for that.
Okay,
Thank God
good.
for
I
that.
was going to ask you if it was bright enough.
Wow, this is bright enough. This is bright enough. This
Okay,
is good. And
good.
you're looking beautiful. So,
Thank you.
doctor,
You
like I
too,
said,
mama.
we are blessed to have you here with us tonight on part 2, God in Science,
Mm-hmm.
Demystifying Infertility. It's something we really want to hear much from you. Information is power, and we know you've been educating us on this. We want to hear more. So I'll give the next 25 to 30 minutes is yours, doctor. I'm not going to interrupt.
Okay.
So the ball is in your court. So, and you might
Okay.
see me highlighting you alone on the screen. Don't worry. We
Yes.
just want to hear from you tonight. We don't want the host
Okay.
interrupting you like the feedback we got. So thank you, doctor,
Okay.
for honoring our invitation. The ball is in your court now. Thank you.
Okay. So, good evening, everybody. So I'm Dr. Sharon Peters. I'm a reproductive endocrinologist. I currently work for FertilCity Clinic in Lekki, Lagos. Like Mama said, I already did a whole lot of introduction of myself in the part one of events. So I would like to just get straight to it today. So when we say God in science, really, what do we mean? So we have come to grow and come to know. I want to assume that everybody streaming are Christians. So, and if you are not a Christian, please come to this side of the poll. Being a Christian is everything. So, living the life of Christ and being Christ-like and following Christ, we'll come to learn that life is actually spiritual and a lot more spiritual than it is physical. So when I say God in science, it I just mean the graces of God, the gifts of God that enables us to be able to help these couples to complete their families. Sometimes we have amazing testimonies of, you see a couple and the child will say, "Oh, how long have we been trying to get pregnant?" But they'll say, "Oh, we've been married for a few years now," and you are trying to get specifics. They don't want to really even say anymore because a lot of couples have counted the years so many times. They are kind of broken over the number of years they've been married. So they just say, "Don't worry about that, doctor. But this is our age. This is what we have been going through. We have done or not done treatment before, we have done or not done tests before, and so we take it from there." So it's just amazing that, you know, when at the end of the day, when their babies arrive and they tell you their true story, even I, as a doctor, am blown away.
Hmm.
So I posted a couple of weeks back on my status on WhatsApp to say, may I never lose my awe of
Hmm.
the graces of God and how He has chosen to use me as a vessel to this couple. So I would just like to briefly go over the different areas from which infertility could occur. So number one, I would like to just state today is male factor. Now, unfortunately, globally, male factor has been underplayed for so many years, in fact, so many decades, so many centuries. From time immemorial, women always wanted to have children. In fact, the cesarean section is called cesarean because the warrior, the Emperor Julius Caesar, was born by a C-section. His mother had been in labor. The story is that his mother had been in labor for days and she was losing life. It was still not happening because he was a big baby and he was said to have been a warrior from his mother's womb.
Hmm.
So, one of those physicians at the rear at that time actually broke a bottle and slit the mother's stomach open. That since she was going to die, they should bring out the baby.
Hmm.
And that's how the cesarean section came about. Although it has been well refined since then, it's no longer a middle cut, it's now a lower segment, um, harness still across tummy scar, for which people are now able to still wear bikinis, but that's not how cesarean section started in the first place. So what I'm trying to get out is that women always wanted to have children, so they will seek help. So there are three aspects for which women would sometimes have challenges. Number one is uterine. Number two is fallopian tube. So we'll say that is tubal. Then number three is ovarian. The ovaries are where the woman actually um, produces eggs and then releases the eggs. So today I want to start from the male factor. Now, because there's a lot of study and understanding on female challenges, they've been able to group them into three groups. And then male factor is just male factor. But now, as science continues to evolve and God continues to give us grace for these things, we find that some men have poor sperm count.
Hmm.
So apart from count, some men will have normal sperm count, but they have what they call poor motility. So they have millions of sperm, but the sperms are not just swimming.
Hmm.
They are just lazy. They are just in one place.
Hmm.
And then there's also the morphology. So some of the sperm seem to be okay in the count, and maybe half of them are swimming, but they are mostly abnormal. They have big heads. They have no point for attaching to the egg, no acrosome. They have no middle parts, so they don't even carry DNA. They have coiled tails. They have double tails. So those are said to all be abnormal. They will also have agglutination, where sperm cells tend to they glue together in pairs, or sometimes three or four of them are together. So it means that they, when they hold on to each other, they inhibit each other. They do not allow the one that could go and fertilize the egg to fertilize the egg. So
Yes.
indeed, there are various aspects also to the male factor, but of course, it's still burden, because like unlike 50 years ago now, there are a lot of Christian and even secular men now who know that it's not just about the woman, and so they've learned to attend clinic appointments with their partners, seek help with their partners, and so the more tests are being done on the men, the more the statistics are now coming out and becoming obvious for us to know that, oh wow, male factor is actually even predominant in this part of the world, which is interesting, because those statistics we didn't have them 3 4 decades ago. Because if one woman is not having children, the man is happy to take another wife
Hmm.
instead of trying to find solution to the problem.
Mm-hmm.
But all that is
Mm.
changing gradually, and as it is changing, we are seeing more and more that, for example, at FertilCity, um, even when we have no female factor, we have male factor. When we have female factor, we have accompanying male factor. So 75% of the couples that come into the clinic, there's a male factor. And it's just amazing, because before they arrive in the clinic, these men think that they are above board. They're actually very sometimes unpleasant with their wives, in terms of, oh, I don't know what the matter is, why you are not able to get pregnant. I'm under pressure. People asking me questions. And they say a lot of things to their wives, and they come to the clinic with shoulder high. Doctor, help me to help my wife. I don't know what the problem is. But as soon as these results are out, and we are able to explain to them that, sir, your sperm count is normal, but your sperms are so lazy they are not swimming. So even when you're having intercourse, your sperms are probably just staying in the external genitalia of your wife. They can't even swim up to go look for an
Mm.
egg. So the men that were sitting with their shoulder high before, they start to slouch gradually.
Mm.
Gradually, they start to reduce their height. and after that initial consult, where they now know that there's a male factor, they become better husbands. I would like to put it
Yeah.
like that. They
That's right.
become very
That's right.
cooperative. They attend clinics with their wives. They try to they listen more once you have explained to them that, oh, guy, you are not so perfect after all.
You
So
see?
so it's simply amazing. Um,
That's right.
and then it's interesting now, because statistically, so many male factors. So it looks like the worst um is happening now, because WHO is actually also dropping the barrier. A couple of years back, you have to have had 25 million and above, with
Hmm.
50% motility and 5% normal forms, for us to say you have a normal sperm count. But the latest WHO reading after the COVID, I think was 2021 or 22, they are now saying if the man can even manage and have 15 million, and
Hmm.
only 40% of the sperm can be moving, please just tell him it's normal.
Wow. Wow.
So
Wow.
they're actually
That's
dropping
what.
the criteria, because because globally there's a lot more male factor infertility we now see than before. Now, another important thing I want to reiterate is the fact that WHO said there's no infertility anymore.
You see?
Why are they saying that? They're saying that because there's so many treatment options available. You can do an ovulation induction. You can boost sperm count. You can
Mm-hmm.
do insemination. You
You
can do
see?
timed intercourse. You can do IVF. where the woman is not doesn't have egg, either premature ovarian failure or older women they can do donated eggs. There's donor sperm. There is surrogacy for women that have repeated issues with their uterus and everything like that. So because the options are now completely unlimited and endless, they are saying no, you can't use that word for anybody again. Is either they are not
mm,
just trying and they're not making good use of the options that are available to them or something. So it's no longer that they are infertile. So which
mm,
is a good thing, and which means that we all need to embrace the treatment options that are available. So one of the feedback we got from part one was somebody who was concerned about uterine factor subfertility. So I want to go back there today to talk about what are the different things that will say that will make us say a woman has a uterine factor subfertility. Number one is for a woman who will have scar tissue. So the most common one is called Asherman syndrome. So this is a situation whereby the endometrial lining of the womb is completely scarred.
mm,
Therefore, some of the women will not have periods. Some of them will have very scanty periods because that mucous lining of the endometrium, of that lining that lines the womb that allows embryo to implant and allows the baby to grow, has now become scarred, either
mm,
from previous instrumentation, having done surgeries, and all that. So that is one way a woman can have a uterine factor. Another way is when women have adenomyosis. Adenomyosis is a situation whereby these specialized cells that line the womb are supposed to be only in the lining of the womb because
mm,
cyclically they will shed themselves. But unfortunately, sometimes congenitally, which means the person was born that way, sometimes post surgery, some of those cells in the endometrium are now deposited within the myometrium, which is they are now inside the muscle of the uterus. So what happens is that as the woman now has normal period, she will now also be bleeding into the muscle of her uterus.
mm,
So of pain, but also they now have gallopy uterine cavity because behind the lining are pus and puddles of clotted blood from period
mm,
they get month by month by month.
mm,
So adenomyosis will grossly cause a uterine factor. One, some of the women are unable to have implantation because the lining is compromised. Some of them will have implantation, but they would have um, early. They will have premature deliveries. And
mhm,
I know of a woman. In fact, she's actually a relative. She actually had her first child, but after that, it looks like the adenomyosis got worse. After that, I know of six different pregnancies she had, some up
mm.
to 7 months, and then you can't go
Wow.
beyond that.
Wow.
So those kind of people will say they have uterine factor, and then there are other people who have fibroids. So fibroids are muscular growth that can grow in and around the uterus. Now, unfortunately, the fibroid story is a little bit interesting in that some families have them familially, which means you can have a patient, her mother had fibroid, her aunties have fibroids, her older sister has fibroid, she has fibroid, her younger ones have fibroid. It seems to just run in some families. Other
Okay.
people, they don't have anybody that have ever had fibroid before. They're a bit shocked and they wonder why they have fibroids. But either way, what happens is that the fibroid is a muscular structure. It grows in and around the uterus. Now, when fibroids are outside of the uterus, we say they are subserous because they are only attached to the womb by the serosal layer on the outside. Those kind of fibroids are mostly ignored unless when one, the woman is not having heavy that
Mhm,
could make her become anemic and that can affect her health, or two, they are degenerating for some reason, and the woman is in pain, and that is not affecting the quality of her life. Otherwise, just ignore it.
Hmm.
Then there are another type that are within the muscle of the uterus. So they are not in the lining, because the uterus is a muscular structure. So they are not inside the lining of the womb, they are within the muscle, inside of the muscle. And those are called intramural, which is within the musculature of the fibroid. Those ones sometimes we can ignore, sometimes we can't, because they can either take the pathway of growing outside. So they grow towards the outside of the uterus, where they still leave the endometrial lining intact. In those
Hmm.
cases, the women can still have implantation and therefore carry pregnancy to term.
That's right.
Or sometimes they grow inward. So when they are growing inward and they are now causing indentation and shifting the endometrial lining, then for women who are trying to have children, to remove those.
Hmm.
The third type of fibroids are the ones that we call submucous fibroids.
Okay.
So the submucous fibroids are actually within that mucous layer
Hmm.
of the uterus, right inside the cavity. So those are a problem. And
Yeah.
no matter how small, the recommendation is usually to remove it. One, any place that there is a fibroid, the embryo cannot implant. So
Hmm.
even though the woman is having her eggs fertilized when she's having intercourse with her husband every month, because the fibroid is everywhere, she's not experiencing implantation and she's still not getting pregnant. That's number
Hmm.
one. Two, for a lot of women who have intracavity submucous fibroid, the fibroid will act as a space occupying lesion. So what that means is that they are going to compete with the fetus, especially at that early stages, both for blood supply, for nutrients, and everything. And sometimes they tend to overcome the fetus. But sometimes the fetus, all these God
Hmm.
sent stubborn children, can actually outgrow the fibroid and still
Of
be born
course.
at term.
Of
So
course.
those within the cavity are usually the ones that has to be removed before a woman is trying to get pregnant.
Hmm.
I would like to say, if a woman sees that she has fibroids, as long as she is not bleeding,
Hmm.
as long as
Hmm.
it's not blocking the path from which she will get pregnant,
Mm-hmm.
and as long as she's not in pain, my
Hmm.
personal recommendation is usually to leave the fibroids alone.
Hmm.
So
All
some
right.
women get very, they get touchy. Oh, my fibroid is making my tummy to protrude and everything. Oh, and everything. So I said, just leave it alone. Because from experience, because fibroids are still idiopathic, which means they are mostly of unknown origin.
Mm-hmm.
We really don't exactly know what causes them.
Hmm.
They say some kind of fatty diet makes them worse. Those are just theoretical, they are not evidence based. And my thoughts on fibroids are that because it is more of a Negroid woman's um, challenge than general population of Caucasians and all, nobody's actually um, devoting any serious resources towards its research. So because of that, we still know very little
About that.
about the
Okay.
disease or about the condition called fibroid. So at the end of the day, what happens is that the fibroids will continue to grow. And when the woman is ready to start having babies, if the fibroid is inside the cavity or on the way that might cause an obstruction to the woman having the baby, then she can remove it. Why? Fibroids usually grow back.
Hmm.
So what that means is that if you, without a woman trying to have a baby, and the fibroids are not really a problem, when you go take out a fibroid, you already projected the woman for a second surgery. You're already
Wow.
priming her to have another operation eventually.
Hmm. Hmm.
Because most fibroids, there are very few fibroids that don't reoccur. Most
Hmm.
fibroids reoccur. And
Hmm.
unfortunately, some are a lot more aggressive than others.
Hmm.
We have
Hmm.
some patients, they'll say, oh, I did surgery last year. I'm scanning them this year. I can't even see space in the uterus. There's fibroid everywhere. And they
Wow.
are showing me the reports. They actually remove.
Hmm.
Ah, doctor, I swear, oh, this time last year I was in hospital. I was removing fibroids, but there are fibroids everywhere again.
Oh.
Sometime I actually had a patient who was on the queue for so long in the UK trying to do get her fibroids out. At some point, she got a bit frustrated. She went private and took them out. And then they told her to rest for 4 months and then try for pregnancy. When she came to Lagos for her IVF, there was no space in her uterus. I had to tell
Oh
her
my
to
God.
request for a report. Yes, to request for
Oh.
a report from that her doctor that did the surgery to see is it that these are just new fibroids or they left smaller ones behind and they have
Hmm.
now quickly grown back. So, which was the case? The surgeon said there were so many fibroids, they had removed so many big ones, she was
Hmm.
bleeding, so they left the small ones behind that they would not be a problem. And in 16 weeks, they had grown back.
Hmm. Hmm.
So that's the challenge. So, at the end of the day, my advice is actually you remove the fibroid at a point where you are ready to use the uterus because
Hmm.
nature abhors vacuum.
Hmm. Hmm.
There's no vacuum in nature. If you
That's
take
right.
out the fibroids and you're not trying to get pregnant, they
Oh
will grow
my.
back.
Wow. Wow. Wow.
They will grow
Hmm.
back. So there's
Hmm.
no need for you to continuously subject a woman under the knife over and over again. So we wait. When she's now ready to carry a baby, then yes, she can now
Hmm.
remove the fibroids and then now get. So some women who have those recurring fibroids, I have some patients. They will just come and they just lie on the floor in my office. I've done fibroids 4 times. I can't believe
Wow.
you are telling me I still
Yeah.
have fibroids. So for
Oh
those
my.
kind of women, we just recommend for them to have surrogacy.
Hmm. Hmm. Hmm.
So we recommend for them to have surrogacy. A lot of them end up having hysterectomy. They just take out the uterus because they would have had 4, 5
Hmm.
myomectomies and the fibroids keep growing back. It's
Hmm.
um it's just nerve-wracking for the doctor. It's heartbreaking for the patient who have to go under the knife repeatedly. So you even when so for some women who are now ready to have babies, they go under the knife. They say, okay, let me try at home for 6 months with my husband. If it's not working before I go to a clinic for assisted reproduction, in that 6 months, fibroid grows back. So
Wow.
so so because we see that too often, we are now saying just be ready
Hmm.
to be pregnant before you take out the fibroids.
Hmm.
Because
Thank you.
it doesn't have additional value to keep
Hmm.
going under the knife because every
That's
surgery
right.
carries its own risk. Every
Oh,
surgery
thank
carries its own risk. Yes.
Thank you, Doctor. I will, in the next 2 minutes, because I want my audience to ask questions. I want you to talk about male factor, the male factor. I know you've spoken so much about fibroid and the female factor. What about the male factor?
Mm.
Few things that could cause
Okay.
infertility and what they can do. I want you to talk about that in the next 2 minutes, two or
Okay.
three
So
minutes.
I actually started with male factor when I said a lot of male factor diagnosis is being made because a lot more men are visiting clinics with their spouses, unlike previously when they were not coming. So yes, some men will have low sperm count. Some will have poor motility, which is ability for the sperm to swim and find an egg. Some will have a poor morphology. Some will have round cells, which means that they have some kind of bacterial infection ongoing. Some will have agglutination, which means that the sperms are gluing to each other. And then some will have some sperms are kind of acidic. They have low pH levels. So so the more we dig into the main factor, we are now seeing there are a lot of things that could also be responsible for this couple
Not having, okay.
not yet getting pregnant. That is not on the woman at all.
Hmm.
So of course
Hmm.
for the male, I think the first thing is lifestyle. The way we try to manage them is first of all lifestyle because a lot of men who take alcohol excessively and who smoke tend to have abnormal sperms, even if they have good sperm count. So lifestyle is very important. Those smoke, but they go and sit in bars where people are smoking every day or regularly. They become secondary smokers, and that's also part of the challenge. So then, weight gain in men, because the female hormone estradiol, estrogen, is associated with fat in a woman, or it's associated with fat generally. It's a fat soluble hormone. So the fatter a man is, the more of that female hormone he will be generating, and that directly impedes his ability
Hmm.
to produce sperms. That's why you see men who are fat tend to have breasts,
Wow.
because
Okay.
they produce more female hormones. So that's the part of lifestyle. So I would say smoking is a no-no if you're trying to have a baby and you're a man, especially when you have already done the semen fluid analysis. That is not optimal. So smoking is a no-no. Alcohol is to be at the barest minimum. The man, we advise them to lose weight, and then we also say they should take all these supplements. So there are some vitamins that may be not readily available in the kind of meals that we eat these days, because as the world evolves, we eat more and more processed meals than organic. So we now
Yes.
have to take those vitamins extra. So on
Okay.
like when we're eating a lot of organic things, where you just go to the farm, get the veggies, and it's directly to your pot, you are
Hmm.
getting a lot more vitamins and minerals in those days of
That's
my
right.
grandmother than in our
Mm-hmm.
time. So
Hmm.
basically, basically, we now need them to be on any supplements that have things like zinc,
Yeah.
selenium, yeah. So just to help to make their body, their general body system, more conducive for continuous spermatogenesis to be happening. Then some men have a condition where that we call varicose veins. So the way God has created the male anatomy is such that the testis is outside of the body, and the reason is because inside of the abdominal cavity is actually 37 degrees centigrade, but outside of the body, room temperature is usually 25 degrees centigrade or less.
Hmm.
So in nature, God wanted the testis to be in
Hmm.
25
Mm-hmm.
rather than the ovaries that is in 37. So
Hmm.
that's the 12 degrees different. That's a lot. So, but unfortunately, some men have these large veins in and
Hmm.
around their testes that are called varicose veins. So,
Hmm.
what the presence of that is, there's a additional blood flow and
Okay.
additional
Hmm.
warmth that is not required for the testes. So that actually affects their spermatogenesis. So there's a simple procedure for it. It's called varicocelectomy. So a lot of men, when they do it early enough,
That's
are
right.
able to completely reverse, are able to
Okay.
completely reverse the statistics of the parameters of their statistics of their parameters. So they get better count, better motility, better morphology. But
Okay.
sometimes when that exposure is too long,
Mm-hmm.
when they do the varicocelectomy, what happens is that they stop the degeneration, but there's not necessarily a reversal, because the
Hmm.
testis has been exposed to the heat for too long.
Wrong.
So even though it
Okay.
doesn't get worse after that, there's not necessarily a considerate improvement in their sperm count. So these people will still need assisted reproductive technology.
That's right.
Unlike when
Thank
they do the varicocelectomy, quite
you.
early. So,
Yes.
and then there are some men who, as children, were born with undescended testes.
Hmm.
So, undescended testes is will I say is rare. It's fairly common, where at birth the midwife or whoever is there, the first thing they do is actually to feel the scrotal sac to be sure that both of the scrotal sacs contain both testes.
All right.
So in the days before the structured hospital setting for delivery, some people used to deliver at home or in places where the people that are assisting them are not necessarily specialized. So, especially in my part of the world, so what happens then is that a lot of babies were missed at birth, that they did not have
Mm.
one or both of their testes
Testis.
descended into the scrotal sac. So now for children who have undescended testes, they advise that by their fifth birthday, they
Okay.
should go and do the correction,
Okay.
which
So
means
it's correct.
they will go and do the surgery and bring this testes out of the inguinal canal, which is intra-abdominal, and bring it down and put inside the scrotal sac.
Okay.
Because by the time those children attain puberty,
Hmm.
more often than not, the testis is completely fried.
Wow.
So,
Wow.
yes. So, for men who have both undescended testes that do not have their surgery in the first decade of life, they usually, more often than not, are completely sterile.
So it's more advisable to do it very early for them, before the age of 5. Did you say?
Yes, by their fifth birthday,
By
they
their
should have
50. Okay.
removed it. Yeah, so that the
Okay.
heat that the testis was exposed to will be limited, and
Okay.
then the child can still from there start to proliferate, and by the time they get to puberty, they are fine. But if they
Thank
get to puberty when the
oh
testis is still intra-abdominal exposed to all those heat, then it's a problem. Then there's
thank
also those people who, okay, go ahead, ma.
There are also those people, you were about to mention a point.
Yes. So I'm also there are also those people who either as young men or as full adults or maybe young boys who fall astride, which means is either they fall on a bike or they
Mm.
fall in a gutter or something, and they
Mm-hmm.
cause direct trauma to the testis. A lot of
Okay.
times, because it happens when the male child goes without permission to go play soccer or to go play
Mm-hmm.
without parental permission, when they experience those trauma, they're
They
so
don't.
scared because they didn't get the permission to leave the house. They actually don't even report to the adults to say, "Oh, I
Wow.
had a fall today."
And
So
it
they
will
try to
affect.
bear the pain, and the pain is
Hmm.
usually severe. But after some time, the pain
It
will
goes.
start wearing away. When the
Hmm.
pain starts wearing away, that is dangerous because it means that the testis is dying.
Wow.
So because the cells are dying, the pain will wear away and eventually pain will stop. And they will just think that, oh, no problem. Meanwhile, that is
Hmm.
when the problem truly and really has started. So that could happen
Wow.
for trauma. They could have actually have crushed testes. Some people will have testicular torsion.
Hmm.
Yes. Usually those two are supposed to be medical surgical emergencies where they are rushed quickly to the emergency room and the torsion is reversed, and whatever the slack is
They quickly
sutured
res-
to put it intact so that the blood supply to that testis is still intact. When you leave it
Hmm.
twisted, all the blood vessels, both venous and arterial, twist. So there's pain initially, but after some time, you just see that because it's twisted, the vessels are no longer supplying. So that testis become necrotic, and then gradually that testis die off. Those
That was it.
people only are able to recall the whole story when they are now in the office of a specialist in their adult life, and you are telling them there's
Hmm.
no sperm at all.
Oh my God. Oh my
They are now
God.
recounting. You know, say, "Oh,
Oh.
your testes are so small. What
Hmm.
happened? Did you ever have trauma?" They say, "Oh my God," and then they
Oh.
are recurring. Some of them, their
Oh
mothers already passed away, never knew they had that trauma.
my God. That
In
was
my
it.
experience,
That was quite informative. That was a good information. I'm hearing this for
yes,
the first time. Oh, thank you, doctor.
yes,
Thank
yes.
you so much.
You're
Thank you so
welcome,
much. It's
Mama.
time for our question and answer. Please, if you are connecting
Yes,
us, let's see you appreciate doctor in the chat and let's see your question. Now, doctor, the last time you were talking about the importance of couples doing assessment. So, for the
Hmm.
benefit of this part two, how long should a couple wait before seeking fertility treatment? We have some people after 1 or 2 years, even some, like you said, some after 10 years, they just come for assessment after 10 years of marriage. So, how long will you advise
Yeah.
a couple to wait? That's very key. I want you to talk about that briefly.
Okay, so for me, sometimes I have people walk into the clinic. They are both in their 20s. They've been married for only 6 months, but they're a bit anxious because nothing is happening. I just ask them for regularity of intercourse and reassure them.
Yeah, that's right.
And
Okay.
then a lot of them don't come back, they get pregnant.
Ah, that's
So,
right.
so,
Yeah.
but if you are seeing a woman who is 40 and she got
Mm.
married 3 days ago, it
Mm-hmm.
doesn't matter. You have to start assessing her right away.
Mm, mm,
So,
mm.
of course, usually on a like a general platform on a flat slate is to say everybody who has tried unprotected regular intercourse, regular being 3 times a week or more, um, for 52 weeks, which is 1 year, one calendar year, and there is
Yes,
no pregnancy, should go get assessed. But
that's
of
true.
course, when they are younger and maybe there was a missed period along the line, which indicates that, okay, things are fine, but just that it hasn't happened, you can
Mm-hmm.
say give it another 6 months to 1 year
Mm,
for
mm,
young people, you
mm.
know. But generally is 1 year. But there are some people you see, a woman is 39 and she got married last weekend. Even if she married on Saturday, yesterday, and I'm seeing her tomorrow, Monday, I'm assessing her right there
That's
because
right. That's
yeah, because at age 40, you have declined ovarian reserve. A lot of them would have had things to the lining of their womb because, like I said, nature abhors vacuum and everything. So those people, you are assessing them right away because of their age. So there's no
yes.
one size fits all, but yes, um, generally 1 year there's no pregnancy. Do the assessment, see that everything is fine, so that you are reassured, and then get
Thank you,
busy.
doctor. Thank you
Yes,
so
ma'am.
much. We have a question here, doctor, because it's question and answer time. Please, if you are connecting us, this is the time to ask your question. It's free consultation now. After today, if you consult doctor, she's going to charge you. It's not going to be free, but don't worry, you get discount when we give you
Okay.
referral from this ministry. Now, the question is this, doctor. My question is, what could cause second trimester recurrent miscarriage? 4 miscarriages in the space of 2 years. Somebody is asking that
Mm,
from the chat.
okay.
Second
So,
trimester recurrent miscarriage. 4 miscarriages in the space of 2 years.
okay, second trimester. If I could know the exact number of weeks, because anybody that is for 14 weeks, for example, is already second trimester, but that doesn't necessarily count to be second trimester. So now there are 3 trimesters in pregnancy, and they're divided into 13 weeks each. So the first 13 weeks, more often than not, the miscarriages that happen at that time are mostly chromosomal, which means that the fetus is actually not forming as it's not forming perfectly, it's not forming well. So
Mm-hmm.
God in his infinite mercy has been omniscience, has caused that when the cells that are supposed to be forming the head are going towards the leg or anything like that, the
Mm,
pregnancy is supposed to stop and the woman is supposed to bleed out.
mm,
So that's for first trimester. Now the third trimester actually from 26 to 39 weeks. So that is mostly mechanical, which means that depending on the weight or the baby has gotten to, a lot of women who have what we call cervical incompetence, where the cervix is not holding but is losing before labor.
mm,
So, but you see this second trimester that is in the middle, second trimester is still further divided into two. Some professors of experience will say into three. So the first um, 5 weeks of 4 to 5 weeks of the second trimester, which now means up to 17, up to 16 to 18 weeks are still grouped with the first. So more often than not, those losses are still kind of chromosomal. They are not forming well. Then the
Okay.
ones that are now like maybe from 20 weeks and above, even though it's still within the second trimester, it could also be cervical incompetence.
Mm-hmm. Okay. Okay.
So another thing that causes miscarriages is actually infection that could lead to premature rupture of the membrane.
Hmm.
So we'll
Hmm.
need a bit more details from the person
Okay.
in question to be able to
Okay.
give adequate advice and counseling accordingly.
Okay. Thank you, doctor. You need to consult doctor for further advice on that. I believe doctor has answered that, Mr. Ebunoluwa Ashonibari. Yes. Yes.
Okay, so
Yes.
you
So,
see what the person has responded. He
okay.
said
Let's see.
22 weeks was one. Then there was 9 weeks. So 9 weeks we just considered to be chromosomal. 22
Mm-hmm.
weeks was one. There was 21 weeks. So those 21 and 22 weeks would be more mechanical than chromosomal. Because at
Okay. So,
20 weeks, I would like to know if at 20 weeks this woman had an anomaly scan done. Because at
mm,
20 weeks, that's a defining point where the
yes. Yes.
woman is supposed to have an anomaly scan done. We want to see, is baby forming well? Are the 10 fingers there? Is the face forming?
Yes. Yes. Yes.
Is the brain forming well? Is the four-chambered heart okay? So when you're able to do that like that assessment at 20 weeks. So I would like to know the pregnancy losses at 21 and 22 weeks. Where what has this have they already done their anomaly scan to say everything with the baby is fine or
Mm,
not? That will also
mm.
help me counseling the person accordingly. Yes.
Thank you. I think the person, I would advise that the person should see the doctor after this program. Abi, what
Yes.
do you think, doctor? The person should see
Yes.
you
Yes.
or
Yes.
consult
Yes.
you rather.
Person should
Anywhere
see
you are,
me and make sure the person should say the person is from the family group so
yeah.
and the person can get the discount that you have, ma'am.
So I hope you had that. You need to get a referral that you are from Blessed Family Ministry, and then the doctor will give you discount. I think you need to see the doctor. Thank you, doctor. Now,
Yes,
is
ma'am.
there age barrier, to the issue of seeking fertility treatment? Is there age
Mhm.
barrier? Like I said, one of the things that actually woo me to you is this of the woman, the 52 years old woman that had triplets in
Yes,
your clinic.
yes,
Oh my God, that
yes,
was awesome. And that one never left me. So I said, this doctor,
yes.
me and you.
So,
So is
okay,
there age
so
barrier? When it comes to
yes.
women seeking fertility treatments, people have been married for 20 years, 18
Hmm.
years, 15 years.
Hmm.
Is there any, what do you,
Hmm.
I want you to say one or two things about that,
Okay,
doctor.
so for us, I put an age barrier, and I will tell you why.
Okay.
For me, the age barrier, we I actually use 52 as the highest for which the woman should seek treatment by herself. And so that mama, she actually came in, she was almost 53. So I said, oh, you're almost 53, we're not going to treat you. And she refused to leave.
Wow. Oh, God.
So she was a stubborn patient. She refused to
Mm,
leave. And her first two treatment cycles did not work.
mm,
And so I said, okay, why don't you try surrogate? And she said she was not going to be able to afford to use a surrogate. Hence we say, okay, for this last one, let's put three embryos. And the God in science messed us
mm,
all up
mm,
because we
mm.
were just saying, let's put three so that at least one should stay. That's how Mama got pregnant. I used to call her Ya. So that's how Ya got pregnant.
Wow.
Um, I did her scan. She had three gestational sacs separate. No one splitted. They all just implanted.
Wow,
I had
that's
to
God
tell
for
her, say,
you.
see, yes, she lives Igondu,
Nigeria. Okay.
But I had to tell her to go to maternity because I know the good NICU. I said these babies are going to early.
Mm.
Your age, triplets, they are going to come early. So I want you to go to another maternity so that when the babies come, you will not spend too much money in
Mm.
NICU because NICU in private care they charge as high as 100,000 per baby per day.
Mm.
And so she
Mm.
went to Island Maternity. So her husband would take her all the way from Igon to Island Maternity for antenatal. So guess what? At 33 to 34 weeks, they told her to come on admission. And she was telling the doctor, I don't feel pain, I don't feel anything. So instead of
Mm.
you to bring out the babies and then they are now in incubator and I'm worried whether they'll survive or not, why don't I just stay on bed rest? And
That's true.
when you think it's time to bring out the babies, you bring out the babies. I bet you she gave birth to these babies at 36 weeks and took them home. She's a
Wow.
miracle through
That's
and
good.
through. Three
That's
girls.
good. Mm.
So
Awesome.
that's God in
Awesome.
science. She's a
Yes.
miracle through and through.
Mm.
So this
Mm.
couple, by the time they had this child, they've been together for 30 years.
Oh my God.
When they initially got married, they had a son. They waited for like 8 to 9 years, they had a son. So after
Mm.
that, they tried a bit. When it looked like nothing was happening, they just kind of left it alone. They already had a son. The
Mm.
son, at the age of 19, on his way to Ife, he already had admission, had a motor accident and died.
My
And
God.
suddenly, these people became a couple without children. That's when they started trying again. It was when she told me that story, I said, man, don't worry, we will treat you.
Oh my
Because
God.
I told
We
her
are
she
not.
was beyond the age. But when
Oh
I
my
heard her
God.
story, I said, no, I will
Oh
treat
no.
you. And I'm
Oh
not
no.
going to give up. We will fight together until God answers us. This is
Oh, and
fight
God
to
answered.
finish.
Oh,
And
how
God
awesome.
answered in a
God,
miraculous way. So
God is.
by the time the year they had the babies, when the babies turned one, their father turned 60.
Oh my God. That's God. That's God. God is
So they did the
awesome.
birthday together. It was a big lavish party, and I was invited.
Oh, yes,
So
yes. You deserve that.
so basically, that's God because even for
Mm, that's God.
me, I had told her house had to drive 3 hours traffic from Igondo to Land Maternity. I said that's where you go. That by 32 weeks, these babies have come, oh, blah 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 blah. Because that's my own knowledge as man. But God
You
stepped
see?
in. She was on the
Mm,
bed just
that's
resting. She would call me and be laughing at me. She said, "Doctor,
oh,
they shall say I'm okay." I said, "Ah, yeah."
oh my God. God in
And
science.
this
Hey,
and these
that's
babies
God.
arrived. They are healthy, you know,
Wow.
and they,
That
they've even started crèche and school life now. So awesome, awesome
that
testimony.
that
So
that could only be God. I tell you, that could only be
exactly,
God of God.
absolutely, absolutely
Yes.
good. So the thing is, the reason we say 52
Mm-hmm.
as a benchmark is if a woman gets pregnant at 52, she'll have the baby at 53.
Mm-hmm.
Now, for the sake of the rights of the unborn child, a woman that
Mm.
has a child at 53, by the time that woman is 70, the child is
Wow.
17. That
Oh.
is that is the most you can give to the woman. Because
Hmm.
if you are getting a woman pregnant at 60, you're already
Oh.
disenfranchising the child from the beginning.
You are right. You are right. You are right.
Because when
That's
the
true.
child now needs parents to run around, to do school run, to do PTA, and the parents consultation,
Again,
all this
I
wahala
think
we
that
do.
makes sense. It's true.
The
Mm.
Yeah, at that time, so it is not that they cannot get pregnant. It's about the rights
Mm.
of the unborn child. That's why we put the cap. But that
That's
doesn't
true.
stop them at that stage from adoption. That's why WHO is saying there's no infertility. It doesn't
It's
stop them
again.
from adoption. Now,
Mm.
a woman in her 40s, if she wants to adopt, we advise her to adopt a baby that is just newborn, which means
Mm.
that she can bring up the baby from the beginning. But a woman that is like 55, if she wants to adopt, she should adopt a child that's already 5, 6. So that by the
Mm.
time she's 60, the child is already going into teenage years. because you
Mm-hmm.
have to understand that it's not about you when you want to
Yes.
have children. It's
Yeah,
also about the children. So
that's
some
right.
of the caps we put is not necessarily about the woman. And also, the older the woman is, the more pregnancy is going to affect her health.
It's true. It's true. That's true.
Women in
You're right.
their 20s will just have pregnancies at random, give birth, no issues. But women in their 40s, they would come down with pregnancy induced hypertension, gestational
Mm,
diabetes, and
mm-hmm,
sometimes, even after they've had the babies,
mm,
these conditions don't now go away.
mm, mm,
And
mm.
you want the babies to come into a healthy environment where the
Exactly.
parents are able to take a good care of them until
Mm.
their old age. So
Oh, thank you so much,
that's
Doctor. Time is
you're welcome,
gone.
ma'am.
How time
Yes.
flies. Please, if you are connecting us, can you appreciate Dr. Sharon in the chat? If we have further questions, I don't know whether we could take any question because I want doctor to give us the last word on this issue of infertility is no longer existing. People need to know that there are several alternatives that you
Yes.
can adopt to have your own children. Nobody should be termed barren. Now,
Yes.
knowledge is power. Nobody should be termed
Yes.
barren. There should be no barren in the land. Even the scripture affirms that. So
Mhm.
I want doctor to give us a pattern. But before that, please, if you are connecting us on today, can you just appreciate Dr. Sharon in the chat? That's the least we could do. And like she rightly said, you can consult her. I can see one other question from Mr. from Ashon Ibarre. You can, connect us because you can connect doctor after this program. She's ready, she's
Mhm.
willing, to answer you any question. You can consult her. And like we said, she has been so generous to us that she said anybody from the Blessed Family Ministry, she will give you discounts, whether for consultation or for treatment. Dr. Sharon is there
Yes.
for us. Thank you so much, Doctor.
Mhm.
We can't appreciate you enough.
So
I know you know that. We appreciate you,
thank you,
your time.
Mama.
Doctor is
It's
very
always
busy.
an
Even out
honor
of
to
her
come.
busy schedule, she's always having time for us. Honestly, I'm honored. And the Blessed Family Ministry
Thank
is
you.
honored. And
Thank
like
you,
I
ma.
said, doctor, it's like a calling. I want you to see this as a calling. And there is a purpose why God
Okay,
has
ma.
brought you into this profession. And I want to not only to see this as in the light of, oh, I'm doing my work, it's just my job. It's like a calling that God is using, will use you, will still use you for so many people to
Mhm.
bring joy to their home.
Yes.
You can't imagine how many
Yes.
people are still in trauma of not having any child. So, and I
Yes.
know God putting you in this field is for a purpose. And I know that
Yes.
purpose will be fulfilled in Jesus' name. I so much believe in what you do.
Amen.
And I know God will still use you. God will use your family because you
Amen.
and your family, you are
Amen.
for signs and wonders in the land of the living.
Yes.
This is one of
Yes.
the signs
Yes.
that God
Yes.
is talking about. So,
Yes.
doctor, continue, move forward. God is going to use you
Amen.
more. You have not seen anything
Amen.
yet. So thank you.
Amen.
Please, I want you
Amen.
to you give us your parting word, doctor, because it's not, I don't want to take doctor's time.
Yes.
Please, I want
Yes.
you to appreciate Dr. Our number. This, if you check this page, either YouTube or Facebook, you will see doctor's number, and we'll still share it later. But it's always there. All the information where she works, our website, and
Yes.
the FertilCity Clinic website,
Yes.
our number
Yes.
is there. But if you need more information, please get in touch with us. If you've not subscribed to this YouTube channel, please do, and check all the previous messages. We had part 1 last month, and it was quite enlightening, educative. So you can connect us. You connect doctor, will give you the contact, and like I said, it's free. It's you see it on our page. So thank you for connecting us tonight. Now, doctor will give us a parting words for this session. God in science too.
Okay.
Thank you, doctor.
So, so I believe the word of God that says none shall be barren in the land. I believe so strongly that everything in the Bible is there for a reason. I believe so strongly that infertility no longer, and like I said the last time, and I tell my patients, I said, if there's some recurring, because some people are so happy when they have this recurring or they have scar tissue or something like that. I say, why not try it? surrogate. So for those who can afford it, try surrogate. And some people are usually very emotional and sentimental about it. And I said, hi about Mary. When Mary had Jesus, she was a surrogate. It wasn't her child.
Hmm.
She didn't know
Hmm.
man. She just carried the
Hmm.
baby for Jesus and took care of the baby for and carried the baby Jesus and took care of the baby for God. So the options are limitless. Um, but at the end of the day, what I've seen is that it's only God that gives life.
Hmm.
And I tell my patients every day, if it's another human being that is going to come out of this that we are talking about and doing, it cannot be in the power of a human being. So let's all
Hmm.
stay positive. And
Hmm.
God is in the business of God
Yes.
in science and of giving babies. God bless you.
Thank you, doctor. We are so grateful.
Thank you so
Thank you. I
much,
can see that
Mama.
you are appreciating doctor in the chat. Thank you so much for connecting us tonight. And we know we will still have doctor again in the near future. And it's more, we are Oliver Twist, doctor.
Okay.
And for people asking that how can they contact doctor, like I said, the number is there, but you can also connect. Yes, thank you, Sister Busayo. You can put doctor's number in the chat again. But if you check this page, either the YouTube or the Facebook, the numbers are already there. The contact details are
Mhm,
already there. So thank you very
mhm.
much. God bless
Yes.
you. Thank you so much.
Amen.
See
Thank you,
you
Ma.
next time. Bye.
Yes.
Bye.
See you next time. Okay. Bye bye.
Thank you so much for connecting us tonight. Please share the link to others. Let them benefit from this talk, this discussion tonight. We have part one last month. This is part two, and I know so many people have been blessed. There's some things that doctor even told us tonight that I'm just hearing for the first time. So please share the link to others for them to be blessed. Infertility is no longer existing. Please, let's seek for information. God has said there should be no barren in the land. If you have been waiting for long, this is your time. This is your time to have your own children. If you have been having problems, this is your time. This is the end of that problem. This is the time for you. Please, you are free to consult Dr. Sharon. You can connect us, the Blessed Family Ministry. We are on WhatsApp, we're on YouTube, we are on Facebook. You connect Taiwo Kayode, and then we'll give you more details about this. Then when you listen to this program, the one we've done tonight, when you listen to the recording, you get few details again about what we are talking about, demystifying infertility. No one should be termed barren. And I pray that everyone that is waiting on God for fruit of the womb to have their own children, the Lord will give you your joy, grant you your joy and your desires in Jesus' mighty name. Thank you so much for connecting us tonight. Subscribe to this YouTube channel. We have another topic next month. It's a monthly program. The Blessed Family live stream is monthly. Every month, we have different guests on different topics that impact family lives. So connect us and then you are blessed. Thank you very much. God bless you. See you again next month. And to know the date of our next live streaming, just connect us on all our social media pages. You will get to know what we need to do next time. But I tell you, there are different things we discuss every month which impact our lives, which are said to bless us. Thank you. God bless you. And good night. Thank you. Thank you. See you. Thank you. God bless. Thank you so much.